mask to protect myself. Only wear a mask if you are ill with COVID-19 symptoms, especially coughing, or looking after someone who may have COVID-19. Disposable face mask can only be used once. If you are not ill or looking after someone who is ill, then you are wasting a mask. There is a worldwide shortage of masks, so WHO urges people to use masks wisely. WHO advises rational use of medical masks to avoid unnecessary wastage of precious resources and misuse of masks. The most effective ways to protect yourself and others against COVID-19 are to frequently clean your hands, cover your cough with the bend of elbow or tissue, and maintain a distance of at least 1 meter 3 feet from people who are coughing or sneezing. How to put on, use, take off, and dispose of a mask. 1. Remember, a mask should only be used by health workers, caretakers, and individuals with respiratory symptoms, such as fever and cough. 2. Before touching the mask, clean hands with an alcohol-based hand rub or soap and water. 3. Take the mask and inspect it for tears or holes. 4. Orient which side is the top side, where the metal strip is. 5. Ensure the proper side of the mask faces outwards, the colored side. 6. Place the mask to your face. Pinch the metal strip or stiff edge of the mask so it molds to the shape of your nose. 7. Pull down the mask's bottom so it covers your mouth and your chin. 8. After use, take off the mask, remove the elastic loops from behind the ears while keeping the mask away from your face and clothes to avoid touching potentially contaminated surfaces of the mask. 9. Discard the mask in a closed bin immediately after use. 10. Perform hand hygiene after touching or discarding the mask. Use alcohol-based hand rub or, if visibly soiled, wash your hands with soap and water.